Okay, well, we've still got people joining, but I think we're going to get going because people are on their lunch hour. My name is Robin Tolosky. I'm Executive Director for SAOT and want to welcome you to this lunch hour webinar, Vitamin Nature and OT's Prescription. Just a short background, Anne had approached SAOT, oh gosh, probably a few months ago anyway, wanting us to get behind this new initiative. And so SAOT has decided to endorse this new program. And it's also been endorsed by CAOT as well. So we're really excited to hear more about it. Just so you're aware, everybody is muted and we can't see you, but if you do have comments or questions, please go ahead and post those in the chat box and I'll be helping Anne to moderate that. As well, we will have this as a recording following the webinar. So if you have colleagues who weren't able to join or you'd like to watch it again, pass it along, that will be made available later this week. So with that, I'd like to introduce Anne and let you get started.
Okay, thanks very much, Robin. Welcome and thanks for coming to my presentation. As Robin said, it's Vitamin N, Nature, and OT's Prescription. And I'm speaking today from the traditional unceded and stolen territories of the Treaty 7 nations in southern Alberta and the Métis Nation of Alberta, Region 3. And I wanted to just say thank you for coming. I see a lot of familiar names on there, and a special thank you to my parents that are joining from Ontario. Before we get going, I'd just like to know more about you and using 4 poll questions. So Robin's just going to help with this. So the first one, is your practice primarily located in 1, a rural setting, 2, an urban setting, 3, virtual, or 4, not applicable? Okay, we're going through all 4 at the same time. Okay. Just wait a few more minutes or another. If most people have participated. Maybe 10 more seconds. If that's enough time. Oh, wow. Almost a few more seconds. We're getting to 100% here. Okay, we'll just go until 2 minutes. Okay. All right, we'll end the poll and we'll take a look at the results here. Okay, so is your practice primarily located? Most people are in urban setting for that one. Are you currently using nature in your OT practice? Yes, 29%, that's great. And not yet, and I would like to, 46%. That's exciting. Okay, if you practice in nature, what populations Oh, interesting. Okay, so 10% child and youth, adult 29%, and not applicable for most people. And are you prescribing nature using the PaRx program? And we've got 3% saying yes, and 56% saying not yet, and I would like to. Okay, great. Thanks so much. All right. Sorry, I'm just trying to get my, okay, here we go. Okay, so today my presentation mission is to just let you know about two of my outdoor inspirations and then two nature restorative theories. I'll spend a bit of time going over the health and well-being benefits of nature, and then discuss briefly social prescribing, and then the recommended nature dose. And then we'll get into the PaRx, a prescription for nature process. And we'll have time for Q&A and at the end, and then I've included my references. The next two slides, I'll share my two outdoor inspirations. The first one, healing power of nature. My first inspiration came from my medical adventure. My youngest son, Noel, was born with a rare, life-threatening disease that kept him and I living in the hospitals more than home and away from his big brother, Ethan, from the age of 3 to 11. Being able to flee his hospital room to go outdoors in nature, if only for a few minutes, on the hospital grounds, home to our yard, or to the mountains, always lifted our spirits and offered us a place of refuge, peace, and hope before, during, and after his bone marrow transplant. Being outdoors in nature with our family and friends was and continues to be a powerful tool for our health and well-being. This last photo was taken in March as we celebrated Noel's 19th birthday with a family sunrise hike. My second inspiration came from my Master of Education research study that I just completed last July. I explored how daily 15-minute outdoor walking breaks embedded into grade 10 science and grade 12 social studies classes shaped high school student and teacher perceptions of their health and well-being. This word cloud was generated from 38 students who were asked, "What did you find enjoyable with these outdoor walking breaks?" They overwhelmingly reported outdoors and specifically fresh air as their top perception. Okay, so I'm just going to discuss briefly two of the nature restorative theories. There are more, but I'm just going, these are the two that are found in the research the most. So both theories suggest that natural environments are more restorative than urban or artificial ones. The first one, attention restoration theory, focuses on mental fatigue. It discusses how exposure to nature can improve our focus and ability to concentrate by allowing recovery from mental fatigue. It talks about two types of attention. The first type is direct attention that requires people to sustain focus with an effort. And the second type is involuntary attention, which is effortless. Directed attention is a limited resource that becomes fatigued after extended use. And when depleted, we can experience negative emotions such as irritability and decreased cognitive performance. Nature allows this directed attention to rest, allows pessimistic thoughts to be blocked and negative emotions to be replaced with positive ones. It offers involuntary attention, which is a temporary being away from reality, or also referred to as soft fascination. The second one, stress recovery theory, focuses on physiological stress. It proposes that viewing or visiting natural environments can decrease our arousal and perceived stress levels to promote physiological stress recovery, such as lowering blood pressure. Okay. So Melissa Lem, the director of PaRx, refers to nature as the fourth pillar of healthy behavior, along with exercise, healthy eating, and sleep. I'm becoming a forest bathing guide and forest therapy practitioner right now through a Forest Therapy Hub out of Europe. And so I really like their slide, how they refer to the 5 states of health, and it really aligns with occupational therapists looking at the whole person. So we've got the body, the mind, social, spiritual, and planetary health. Again, just another nice, I'll just move myself out of here. Another nice photo. Sorry, with just a few other things. I'm not going to read through them all, but just really nicely set up and easy to read. Planetary health. So the definition is the health of human civilization and the state of the natural systems on which it depends. So this is the interdependence of human and natural systems. We can no longer separate the health of the planet from the health of its people. And I like what Thomas Berry has to say. We cannot have healthy people on a sick planet. So the next thing I'm going to show you is just a video, because there's so many health and well-being benefits of nature, and it's exploding right now in the research. And so I thought this was a nice way to highlight what some of the benefits are. And this was made by Noel. Okay, next I just want to talk briefly about social prescribing. So when we look at this chart, what makes Canadians sick? If we look at the bottom, our environment, air quality, going up, our biology is only 15%, our healthcare system 25%, but really the biggest thing that is making Canadians sick is our life, which again really aligns with occupational therapy and looking at the whole picture. So determinants of health are the conditions in which people are born, grow, work, live, and age, and the wider forces and systems that shape the conditions of daily life. Nature-based practices can be a factor in reducing health and well-being inequity and influence these determinants of health. I like forest therapy's description of what is social prescribing. Again, the elements, so it's healthcare professionals are prescribing it, and we're recommending resources and activities, again, offered in the community and to people with social, physical, and emotional needs. The goals is to address the inequities, to influence the social determinants, and provide inclusion and social cohesion. Vulnerable groups, including people living on low income, racialized groups, older adults, and children have been found to experience the most benefits from nature, even with small increases in going outside to nearby green spaces. So this is an example of a social prescribing that's found in Ontario. I don't know if people know about this, but it's called mood walks. And obviously what we're talking about today with the PaRx is also a type of social prescribing as well. Okay, we're going to go on to two more polling questions. So the first one is around the recommended nature dose. So people report significantly better health and well-being after spending 1, 2 hours, 3 hours, 4 hours, or 5 hours in nature per week. Okay, a few more seconds here. Okay, great. All right, so let's take a look at the results. So the majority of the people said 2 hours, which is correct. Okay, great. Okay, we'll go on to the next question. Sorry, I have too many clickers going here. The most efficient drop in cortisol levels happens between 5 to 10 minutes, 10 to 20 minutes, 20 to 30 minutes, 30 to 60 minutes, or 1 to 2 hours in nature. Okay, I'll just give a few more seconds. Okay. And okay, interesting. Okay, so we've got pretty close between 10 to 20 and 20 and 30 minutes. And the correct answer that has been shown in a research study that I do have in my references is 20 to 30 minutes. Or actually, it could be 10 to 20 minutes. It's really that 20 minutes. So thank you, everyone, for participating. Okay, so there's that one. Okay, so again, I'm using Forest Therapies Hub slide for this one. And so the two main resources are White and Hunter. So those two studies. So White did look at the amount of time per week. So 2 hours per week is what's recommended. And it was interesting that after 200 or 300 minutes a week, there was no greater benefit. And then with the dose response effect, to get the daily relief, stress relief with the lower cortisol levels is between 20 and 30 minutes of sitting or walking or being in a place that offers a sense of being in touch with nature. And I thought it was interesting as well that beyond 30 minutes, it does provide additional benefits with the lowering cortisol, but it's at a slower rate. Okay, so now we're going to get into the PaRx prescription program. And I just wanted to tell you that I had the opportunity to meet Melissa in March. She's a really interesting lady, and she's done most of this through volunteering, putting this program together. So this program is Canada's first national evidence-based nature prescription initiative. It's through BC PaRx Foundation, and it was launched in British Columbia in the fall of 2020. Then it was in Ontario in February 2021, then Saskatchewan and Manitoba later in 2021. It finally came to Alberta this past March, on March 28th, and it's expanded to the Atlantic provinces, New Brunswick, Nova Scotia, and PEI in April of 2022. And this month, it's now in Quebec, and it's called Prescrit Nature. So as Robin had mentioned, Melissa and I, we did meet with COT virtually in January, and we did attain their endorsement for PaRx, which was wonderful. So I'd just like to give you a mini tour of the website. Can everyone see? Oh no, can you guys see my screen for PaRx? Okay, that's a yes, thank you. Okay, all right, so I'm just going to go into the first one. So about, and I just wanted to highlight a few things here. So I just want to show you who Melissa Lem is. She's a GP in Vancouver. She used to live in Toronto. So really, it's a very small staff that has put this together. So it's herself, Prama, and then this fellow, Matt, he's actually working on putting together an app. So PaRx will have an app that will be available later this year that will incentivize and track information.
Anne?
Yes.
Sorry to interrupt, it's Robin here. People are not able to see the screen. They can only see your slide.
Okay, sorry guys. Okay, let me pull up. Okay, sorry, I can't keep track of, okay. Can someone let me know verbally if you can see it now?
We can just see your slide.
Oh, this is frustrating. Okay, can you see the PaRx now?
Just your slide.
Okay, sorry.
That's okay, it's okay. Thank you, Jen.
No, I'll get it. I just,
Wait, it's okay.
Oh, here we go. Okay, I'm on it. Okay, how's that?
Perfect.
Okay, good. All right. So what I was just saying, now you can actually see what I'm talking about. So I'm just going to go through each one briefly. So we're going to go, so for about, here's Melissa Lem, and here's Prama. And then Matt, so he's the one that is developing the app that will be available. And so that's going to be really exciting for participants to use the app as well. I just wanted to show you, so partners and endorsers, very grateful to COT and to SEOT for endorsing. And you can see that the Manitoba Society of OTs and BC is also going to be up there as well. And I just wanted to show you at the bottom, if you have any other questions that I can't answer at the end, you can contact them here. And they do have a private policy that I will briefly talk about after. So that's in the About tab. Okay, we're just going to move on to the Patients tab. So I like this. So patients can go and take a look and see why should they be filling this prescription that we're giving them. And I like this, that these 5 simple tips are really nice, again, for patients to try and increase the compliance with getting them outdoors into nature. If they do sign up, once they get a prescription from yourself, then they go and they register their prescription, and then there's monthly draws for different types of swag as well for patients. Okay, prescribers. I'll spend obviously the most time on this one. So this, I really like the website. It's really nicely set up. So number 2 here, writing it down works better. So when I talked to Melissa, she just said, really, really it's so important to have it written down and having that prescription rather than just the oral advice. And so if you click on this link, it will take you to the article that supports that. So again, it's just a really nice website in that everyone can access as much information as they want. Okay, number 4, prescribing nature. So this one here, register. So I'm just going to click on that one. So you would just go here, click on licensed healthcare provider, takes you down. You put your name, your email, your practice address or your home address, practice information. So we're other. They want to know the licensing body and your number. And so that's how you register to become a prescriber. And then they'll send you your own personalized prescription pad. And I'll show you a sample of that after. Whoops. Again, some more tips. And this is nice as well, 5 simple steps for an effective prescription. This is what I really like. So they have done all the work for us. So these are amazing resources to give to your clients. And I like that they've got several in the adult benefits and several in pediatric. So these are handouts that you can give. So here's one example. So just really nicely, I find them easy to read. I want to read them because it doesn't have too much information. And then it has the live links at the bottom. So for the ADHD article, you can go right to that as well through the website. I really like the posters as well. I'll just show you one of the posters, the patient poster. So just, yeah, just really nicely laid out posters. Okay. All right, so why nature? So I really like this as well. So they have it broken down into adults, kids, and planet. So again, you can take a look. I'm going to click on this one for my parents. Seniors who live closer to walkable green spaces live longer. My folks get out walking all the time. So this is really nice. Elder health. Again, it gives you just lots of different tips and why it's important for elder health. And again, the links to the live links to the articles. So all the different ones for children and the planetary health as well. The news, honestly, it has exploded with how much coverage Melissa is getting and PaRx, not only in Canada, but worldwide. So it's amazing. So you can take a look here. There's a lot of different resources on here, and there's also a blog as well. And then just this part, log in. So patients can go here and they can log in. And so this is your code that will be on the prescription that you give to your patient or client. And so they're collecting their initials and the email address only. Oh, the other thing I wanted to mention is that we can prescribe one PaRx Canada Discovery Pass per month. So as it says there, it's prioritized for patients who live close to the Canada parks so they can access them, and people where cost is a barrier. And the other thing is, if you do have children that, because kids that are 17 and under, you can get into the park for free. But if the parents don't have the financial resources to take them to the park, then you can prescribe it to their parent, and then the child can use the PaRx pass or get to the park with their parent. Okay, I am going to exit this and go back into the presentation here. All right, so here is a sample prescription. So just to show you, so here is my number, my prescription number here. And so this was for a young adult client, Maple Tree. And so he's going to walk 3 times a week for 10 to 30 minutes with his dog. And again, we just talked about, okay, where would you like to walk? How will you get outside and where will you go? So going to a ridge and different neighborhood routes that he had identified. And then spending time at his sit spot by the Elbow River for 20 plus minutes twice a week. And then going to the mountains every Sunday for a 2 to 4 hour hike. So with this, I just wanted to let you know, so when a healthcare, when we log in our prescription on the website, the only identifying information is the patient's initials, and their name is not included. So if the patient does not want their initials or their email on the website, then really they can't sign up. They have to disclose their email address in order to sign up for this program. So just to let patients know if that's if they don't want to give out that information. And again, just looking at the privacy policy. So PaRx is not contacting or identifying information that is shared without the patient's or the prescriber's consent. We had a lot of questions about that especially with when we were speaking to COT. All right, so I've just put together some guiding questions for when you're putting together the prescription for patients, and general, so that they could be for any age. You can adapt them for any age. First one, how do you feel in nature? Describe a favorite nature memory. So really tapping into that nostalgia is key. What motivates you to go outdoors? When outdoors, what do you like to do? And the last one, what are your nature goals? So again, very client-centered. Okay, this is my favorite part. So I'm going to share with you 9 different slides of nature activities, and some are taken from my forest bathing guide course. So the first one, green exercise, walking, sports, parks, recreation. A sit spot or choco. So this is a place that you go to. It's a comfortable and convenient place where you go to be alone in nature, and one that you return to frequently, so that you can get to know this place and develop a relationship with this place. So you can sit quietly, leaning against a tree, sitting on a rock or a bench. This is Noel's favorite choco that he likes to go to with his brother's dog. So just simply noticing the natural environment around you. You can do mindful breathing there. You can do the sensory awareness grounding exercise there. Rather than, should be number 1, not a question mark at the bottom there. What taste do I have in my mouth? Another nice one is, what is one emotion you feel? Cloud gazing. So feeling the fresh air, noticing skies movements. Again, finding a comfortable place outdoors, standing, sitting, barefoot, leaning against a tree or a rock, lying down in the waterfall position. Again, just for extra calming of the nervous system. So this picture was actually taken, I did a forest bathing walk, and this was one of the activities that people enjoyed the most. Was they spent 20 minutes cloud gazing. So forest bathing, it's a nature-based wellness practice. It's also referred to as Shinrin Yoku, and it was developed in the 80s in Japan. So that basically means being immersed or bathing in the forest. And it's a series of nature activities that enhances sensory and social connectedness. So again, really relates to occupational therapists and what we do. Journaling. So again, just describing 3 good things in nature. What surprised you in nature today? Who lives in this place? People can write down, how do you feel before and after your time in nature today? Gardening, horticulture is huge, especially since COVID. It has exploded even more, and just growing really anything or tending to flowers, shrubs, trees, and really everywhere, work, school, home, lots of community gardens. This is our local community garden. Nature art, so just using any natural objects, and there's endless designs, just being creative and getting your hands on the different materials that nature does offer. So this is a very simple one. Human animal interaction, so domestic, going outside with your animals, dog, cat, wild, looking out at the bunnies, deer, And then animal assisted therapy, horse, dog. If people are not able to go outside, then you can bring nature indoors. Window gazing, you can have the window open so they can hear the birds, they can feel the fresh air coming in. Caring for plants. So again, using your senses, smelling the plants before and after you water them, touching the plants, doing mindful breathing indoors. You could do it with or without essential oils. You could also have a diffuser going in your home. A lot of people love decorating their home, bringing nature in that way. So with photos, pictures on the wall, different art displays, books. So this is one that we have in our bathroom for my boys and we love this. So every time we do a hike or go somewhere special, we collect an item from that place. And so it just brings back lots of great memories for us. You can also do coloring, sketching and painting. Okay, that is it for the activities. I just wanted to open it up to see if anybody has any practical tips that they could share. I do have two that I can start us off with. The first one is weather. So speaking to clients, patients about the weather and trying to put it into a positive spin. And I really like the Norwegian motto. There's no such thing as bad weather, only bad clothes. So just speaking to people about, okay, well, how can you get outside in the rain so you're not going to be freezing and you're not going to be cold and wet? So just having those discussions about layering, just those basic things so that people aren't afraid to go outside if it is raining or snowing or windy or slippery, like putting spikes on the bottoms of their shoes to make it safer for them to walk outdoors. And then the second one is electronics. So I really ask people to put their electronics in nature mode. So either leaving them indoors or turning them off or putting their phones on silent. Does anybody have any other ideas you could put in the chat, or if you want to unmute and just share any other ideas that you have?
Shell D.
Okay.
Which I think is really cool. I might try this myself. She has a box of rocks under her desk, and then she can put her bare feet in the rocks when she's working on the computer.
Oh, I like that.
Yeah.
That would be great for people that are in wheelchairs.
Mm-hmm.
That would be amazing for that. Oh, okay. Thank you, Michelle. That's great. Any other ideas? That's okay. We can, I just want to, we're getting to the Q&A anyways, but just to thank you for coming today. And I can't emphasize enough that everyone does belong outside, and to let's prescribe it. And if you have any questions, comments, want to connect with me, there's my email and my LinkedIn, and there's Noel's email as well. He's the video maker. And yeah, we'll go to Q&A. And then I just want to show you, I do have just the one slide of reference here as well. Okay, I'll open it up for questions, comments, anything.
Just a comment here from Michelle Hampton. She's just saying she likes to be really practical and suggest connections to nature based on where people are at.
Yes, that is really great. And I think that's key to get people outside. So often I'll use, or what I do is I'll just Google map their address, and then we'll take a look and see what do they have access to, that's right there around them. So that's how I do it with the different addresses for different people.
Okay.
And then to take them outdoors is like to take them on that route, or, you know, to take them there and see, is this a place that they would like to come to, that they would resonate with them, would get them outside.
Just a question from Kelly. She's asking, does part of the practice entail spending time with the client in nature?
That's a really good question. And you know what, I definitely think that yes, that for sure you can do. I think having a combination, I think if you can use it as a tool to make that bridge so they'll actually go out and feel comfortable getting in nature. I think OTs have a huge role to bridge that piece. That's a really great comment. Thank you. And same with schools, you know, like taking your, like when I work in schools, like taking kids outdoors, taking teachers outdoors and showing them what you can do outside. So you're with them as well.
Just a comment from Michelle Hampton, just around the fact that sometimes people can get overwhelmed with the idea of getting out to nature because they think they need to climb a mountain or do something, you know, really significant.
That is it. That's a really great comment, Michelle. Thank you. And I think that's what it's really anything. It's like just stepping outside into your backyard, sitting on a chair. The one picture that I showed with the journal, that was on my balcony. So just stepping outside onto your balcony, it doesn't have to be grand, like going and doing a huge hike. It can be very, very simple. It's just getting outside, feeling the sun, breathing in that fresh air, actually getting the benefits that come with stepping outside of your home.
And a question, and does the prescription offer anything for those with transportation barriers?
No, not yet, but I know that Melissa is working on it. Yes, and I will give her that feedback as well today.
Okay.
Yes, that's a really huge one as well.
And also a question, how long will it take to get a pass to the client?
I think it's very quick. Like I haven't prescribed one yet. I haven't had the opportunity yet. But as soon as they go on there, oh, that was the other thing I didn't show you. There is on the website, it shows you I think there's 5 steps of how to prescribe that. And it is very quick. I don't have the exact time, but it's a very quick turnaround, and they mail it out to the client, to the patient, I'm pretty sure.
Okay, thank you.
But I can ask that as well. I'll ask Melissa how long that's taking, and then I can get back. I can get that information as well, Robin.
Great, thank you. And another question, what are the differences between your website and the Forest Therapy Hub?
So the PaRx, is that the one that you guys are talking about?
Yes.
So that is the actual website that Melissa has put together for the Canada-wide PaRx prescription. So I haven't done anything with that. I'm just endorsing it and trying to get the word out there for that part. And then the great question. And then the Forest Therapy Hub, where I did use some of their slides. That's where I'm doing my training. So I will be done this week, and then I'll be a certified forest bathing guide. And then the next part is becoming a forest therapy practitioner. So it's a 9-month process, like 6 more months for that portion.
Wow.
So yeah, great questions. Thank you.
Sounds super cool. And I think I want to become one of those myself. So I think we're going to wrap up. I just want to thank everybody for joining. And again, we will have this up on our YouTube channel within a couple of days, and we'll share the link in case people have a colleague who wasn't able to join today, or you'd like to share it, pass it along. So with that, Anne, thank you so much. This is super exciting. And you have Anne's contact information if you need to reach out to her with additional questions.
Oh, I see there's lots of questions. Sorry, I'm just actually looking at the chat now. There's lots of questions here. Robin, can I just go through these? Can we,
sure,
do we have a few minutes? Like whoever wants to stay on, I'm just.
Yeah, for sure.
Oh, okay. I love all these comments. I need to walk outside every day at work in order to survive. Yes. Helps you understand your own needs. It's real. Yeah, that's amazing. Thank you. And then Eva, thanks Eva for coming. I love the idea of giving prescriptions for nature with a prescription pad. Yes. Again, it's that accountability and increased compliance with having that prescription, having it written down. Okay, we did that, Michelle. Thank you. Okay, that one we did. Oh, yes, that's very true. So being outside on a walk with someone can really open up the conversation, less threatening. That is really true. And in my, so there's a lot of studies on that with ecotherapy and adventure therapy, a lot of, again, with outdoor therapy, just, you know, being outside, being on that neutral ground. So not having that barrier of the therapist is up here and the client is down here, like everybody is on the same playing field. So it really is powerful. In my research study with the students, they loved, that was one of the things that the teacher loved, that they said that they found out far more about their students being outside than they ever would have with being inside the classroom, and that being outdoors was a neutral ground compared to being inside that classroom. And they really, really like that. Again, it brings in that humanity piece as well. Sorry, just quickly looking through here. Oh yeah, so taking clients out on the back deck as opposed to the treatment room. Yes. Great for self-regulation for anybody. Oh, someone, okay, I just said exactly what Michelle put here. Decreases the power differential. So yes, thank you. Who were in a hospital for a period of time? That's a really good question. So if I would definitely prescribe to patients inside hospitals. I think that that's huge. And again, with Noel and I living in the hospital for off and on for almost 10 years, I would have been happy to have someone come in and give me a prescription for him and I to say, get outside. It's huge. Like, and there's ways to do it in the hospital that you can do it safely. You can take an RN with you as well and just get outside the front doors of a hospital. Or I think that is huge for people. There's a lot of hospices too. I know the one that's beside my parents' building that has a huge sliding doors where the bed can roll out and be outside. So again, giving those people the prescription, giving them the idea, yes, get outside, spend that 20 minutes outside in nature. And then the liability, limited mobility. So that was a huge thing that Melissa and I did talk about when we were meeting with COT with that liability piece. And so their thoughts on that was, we're not prescribing exercise. So we're okay that way. And I think as long as you have that liability that we all have, that we have to have. I don't know. I think I feel like I need some more clarification on this, but my understanding when I did meet with him was that the liability that we do have does cover that. So just like you are meeting clients or you're in schools, taking kids outside. But that's a really good question. And just I need to actually contact and make sure that I don't need extra liability. Okay. Okay, thank you so much, everyone. Oh, and yeah, you did send out the slides, right, Robin? They're in the chat?
They are in the chat, yes.
Yeah. Oh, here they are. Yeah, thank you.
Okay. Thanks so much, Anne.
Thank you so much. I wish I could actually see you, see people, but thanks for coming. And thanks, Robin.
Thanks so much. Have a great day, everybody.